With the recent Supreme Court decision overturning Roe v. Wade, many women are appropriately concerned about their choices for terminating a pregnancy. In California, you do not have to worry. Hi, I'm Kevin Knaus with InsureMeKevin.com. In California, we have many protections for women and their health care options, such as terminating a pregnancy. And most health insurance plans must cover abortions. The Department of Insurance and Department of Healthcare Services have both come out with statements just recently affirming the option for terminating a pregnancy within health insurance plans. Now, if you have Medi-Cal, then it is just absolutely definitely covered at no cost. The private health insurance plans through Covered California include abortion. If you look through the evidence of coverage, it'll usually be under pregnancy termination services, and many other small and large group health insurance plans must also cover abortion. There are some plans that will not be covering those services. Those are grandfathered plans that came about before some of the most recent laws were passed, and self-funded plans, some union plans. They can have some different benefit structures that don't match with the Affordable Care Act and California law. But some of the agencies have put out some frequently asked questions about health insurance and how it all works. So one question is, can my private insurer require prior authorization before I obtain an abortion? And right now, that is a yes. Some insurers will require prior authorization. However, in 2023, in California, you will not need prior authorization. You will be able to go and get a termination without consulting your health insurance plan first. Another issue is if you have an HMO and you have a primary care physician, many of your routine services, you must go see a primary care physician first, and then they'll refer you to a specialist. But that is not the case for OBGYN services. You can self-refer to anyone in the network, and that includes services such as pregnancy testing, prenatal care, contraceptive services, including sterilization and counseling, sexually transmitted disease screening, prevention services and treatment, HIV and AIDS screening and prevention services. So if you have an HMO, you do not have to worry that you must contact your primary care physician first and interact with that individual to get a referral for an abortion. You can do it. What happens if there is no one local for you to receive an abortion from, because you may live in a rural area? The health plans are obligated to help you find someone, even if it is out of their network, to perform those abortion services for you in California. So some of the plans will have member cost sharing associated with it. An abortion would be considered an outpatient procedure. So some of the plans will have 20% coinsurance. Other plans, like a bronze, you may have to pay the full amount depending on who you are seeing, which may be very little or it may be very expensive. Like any healthcare service that is an outpatient, you may want to call around and find out who has the best deal for offering you those services. Of course, it's all about getting there, and it's a timely situation. And the health insurance companies cannot discriminate against you. They cannot raise your rates because you've had an abortion. They can't tell you that you need to do the morning after pill or the plan B versus a surgical procedure. You know, that's all up to you. So there's a lot of different options for women's health care and reproductive services in California. Many of us in California are just kind of scratching our head. We don't understand what's going on in the rest of the country, because this is a very personal decision, choice for a woman and no one really needs to be involved with it except the woman, her doctor, and her family. So California is supporting a woman's right to choose and seek her own reproductive health services on her terms. So if you have any questions, there are some numbers and websites here on the screen. Now, we do have two different insurance regulating agencies in California, the Department of Insurance and the California Department of Managed Healthcare. If you have a covered California plan or Medi-Cal and you have questions about your coverage or maybe the health plan isn't assisting you, you want to call the Department of Managed Healthcare. Small group plans, large group plans, some PPO, individual and family plans are governed by the Department of Insurance. Unfortunately, those two different agencies, it makes it a little bit difficult. Or contact your agent if you have a health insurance agent, and they should be able to find the answer for you, because many of the questions related to pregnancy termination and abortion services are outlined in the evidence of coverage from the health plan, regardless of whether it's Medi-Cal, individual and family through Covered California, or a group plan. So if you have any questions, you can leave them down below in the comment section, and I will try and research them and post an answer as soon as I can. So for InsureMeKevin.com, I am Kevin Knaus.